Magandang hapon, Malacañang Press Corps, and welcome to our press briefing ngayon, araw, July 4th. Pinangunahan ni Pangulong Ferdinand Marcos Jr. ang sectoral meeting kanina kung saan nagbigay ng updates ang Department of Health sa mga programang na itupad nila alinsunod sa direktiba ng Pangulo. DOH Secretary Teodoro Herbosa also discussed the agency's 8-point action agenda. And to give us more information on this, we are joined by DOH Secretary Teodoro Herbosa. Good afternoon, Secretary Herbosa.
Good afternoon, Daphne. Good afternoon to the Malacañang Press Corps. So, basically, the things I'd like to discuss this afternoon, number one of the directives of the President to me when he appointed me last month, actually, was to address the problem of TB. The Philippines continues to be one of the top countries with the high burden of tuberculosis, and we're like number 4 ranked in the world. We were already down to number 9, but we actually increased again. So I went around the Philippines looking at the TB dot centers during my trips. Every time I'd travel to a new destination, I'd visit the TB directly observed therapy centers and find out what's the problem or what are the situation. And they've all unanimously said that there had been increasing cases during the time of COVID. And I was surprised because I thought TB would decrease because we were all masked during COVID. But unfortunately, people removed their masks. They masked outside, but when they went home, they were all unmasked. So one case of TB would actually infect the other household members. So there were increasing cases. Plus also, we had the support from the Global Fund. You remember the gene experts, which were also used to actually detect COVID, was actually brought to the Philippines through the Global Fund grant and implemented by our partners, the Philippine PSBP, Philippine Social Business Progress. And they actually brought that to many centers, which detects multiple drug-resistant TB. So our case finding had increased, so that's normal. We will find new cases, but we also need to continue treatment for them. So the newest thing that we're actually going to implement for the next 3 months, for the next quarter, will be the shortening of the course for 2 to 4 months TB therapy with several drugs, which used to be 6 to 9 months. So it's shortened for the regular TB, and then 6 months for those that are multiple drug resistant. We've also started to implement other things like artificial intelligence diagnosis with radiology. So these are things that can pick up through the X-ray. The computer already diagnoses the presence or absence of TB. So we're improving our case detection, and we're also improving our delivery. We're also trying to implement a video-assisted directly observed therapy. Used to be that if you had TB, you'd have to go to the center every day for months, and then the health worker watches you take the anti-TB meds to complete the course. Right now, we're trying to implement video assisted, wherein it can be done through video. Then that removes the problem of falling out of the program. The other thing we've found out is that people fall out of this TB program because after they feel good, there are no more symptoms. They don't complete the course. So it's about literacy, health literacy, and the social stigma that you're going to the TB center. Then people feel may TB yan, pumupunta sa TB dots clinic yan. So these are the things we're trying to correct. Maybe we're able to correct this. We will really decrease and treat our TB cases in the Philippines. On the other hand, one of the things we discussed with the President this morning also is I announced to him that we will already be groundbreaking on the July 17, the Clark Multi-Specialty Center. This was the original one designated in Executive Order number 19 as the heart center that will be built in Clark. We have the land already from the CDC, from the Clark Development Corporation, and then we have the plans already, the design. It will be starting as a general hospital and then move up to a children's specialty and then a cardiac specialty, then the kidney specialty. So it will be just like what we have in the North Triangle of Quezon City, wherein you have all the different specialties, and it will be in that corridor in Clark. So that will cover for Central and Northern Luzon cases of heart, lung, kidney, and even cancer. So that's the big plan for that one, and we will be inaugurating that this July 17. I think I'll end there muna.
Okay,
Daphne?
yeah, let's take questions from the media. Chona Yu, Radio Inquirer.
So sir, ilang Filipinos po ang may TB? Do you have a kahit ballpark figure?
It's something like 1 million. 1 million Filipinos actually have currently positive TB cases. So I didn't bring my figures, but we have the statistics for that, and it's quite a large number for our population. Yes.
Tuesday New, DZBB.
Hi, Secretary. From yung sinabi nyo, 6 months usually yung treatment and program, 6 to 9 months ang TB. Bakit 4 months na lang po? Ano yung mawawala doon sa program o sa treatment?
The WHO has recommended a better regimen with all the different drugs that we combine. So we're following actually a WHO recommendation to shorten. When you shorten the therapy, the chances of fallout becomes less. Kasi because it's so long, yung 9 months, na umiinom sila ng gamot, they don't finish it. Once they don't feel anything, they're not coughing, they don't have fever, they don't go back to the center anymore to take. So, making the treatment shorter will increase compliance. Mas matatapos natin yung treatment, and then we can treat the next person faster.
Okay. Eden Santos, Net 25.
Doc, pagdating po sa gamutan, doon sa gamot po sa TV, is it accessible and mura po ba para naman yung mga kababayan natin na meron nito, talagang tuloy-tuloy yung pagpapagamot?
Magandang tanong yan. Binibili ng government yung TB meds. It's part of our program. Tumutulong din ang Global Fund to supply the medicines. Unfortunately, ang isang defect ng program na nakita ko ay yung logistics and supply chain management. I visited certain centers na walang gamot. Naaabutan nung time ng shortage. So that means it's an issue of supply chain delivery. The medicines are being bought for the estimated number of TB, pero from the warehouse to the centers, parang nadidelay. So this is something I think I can fix. We will try to fix this. Again, the idea is computerizing logistics supply chain so that laging may days to last. We did this during COVID. In COVID, when I was in charge in the vaccine cluster, natuto kami nung sa fast food chain ang nagturo sa amin. They called it days to last. So, you go to any fast food chain, hindi ka maubusan ng chicken or hamburger or fries. Kasi may days to last sila. Ang ginamit namin nun sa vaccine, 7 days to last. So, each vaccine center had vaccines good for 7 days. So, ito yung parang wala pa dito sa TB program. Basta meron, dadalhin. Pag naubos na, kawawa yung pasyente na pumunta doon, naggumastos pa masahe, tapos, ay, ubos na meds namin balik ka na lang next week. You know, so nagkaka-problem in therapy. So these are the things we need to fix. It's a coordination because the national government buys the medicines. The LGU is the one that implements it. Remember, the local government is the one that has the TB dots clinics, and the doctors and nurses are hired by the local government. So talagang requires some level of national and local coordination.
Follow-up lang po, isa na lang. Ibig sabihin po ba yun nagkukulang tayo ng supply ng mga TB meds?
Hindi siya nagkukulang na delay yung pag-deliver. I think sometimes they're just in the warehouse and it's not delivered to the clinic. So I think it can be solved simply with some logistics expert looking and making sure nandoon dumadating yung drugs. So yun isang reasons kaya meron tayong mga increasing cases. Hindi umaabot sa dulo.
Alan Francisco, PTV4.
Hi, Sec.
Yes, hi.
Yeah. Sec, as an health expert, can you please just give advice to our kababayans para maiwasan itong TB? I understand the government hindi po nagkulang sa pag-advise para maiwasan ito. Go ahead, sir.
Sige, paliwanag ko how the approach is. Well, TB is a airborne infection, no? And technically, not everybody gets TB. The first step in prevention is really vaccination. Yung BCG, Bacille Camille Guerin vaccine, which is given to children, to neonates pag pinanganak. So very important yon para hindi magka-primary complex ang children. The second is good nutrition, no? The people that get TB are the people that are immunocompromised. So ano sila? Malnourished, stunted, our children in the poorer communities. The third is social social environment. I know in the informal settlers, you can have four families in one household in one shanty home, and that kind of environment is like a petri dish for people getting infected. So isang tao lang ma-infect doon or hindi na treat, it will spread through the household. So and then the treatment is easy. It's modern day. We have the drugs. We have the treatment to treat TB. It's not stigma disease anymore. We have the medicines. They are modern. Our problem is the social determinants that affect it. Wherein, yun nga, nagtatago sila. Takot sila na ma-identify sila na may TB sila. Kasi if you go to the TB dots, your kapitbahay knows, ay may TB yan, pumupunta dun sa TB dots. Iiwasan na sila, ayaw na silang kausapin. So, that old mentality na, ano yan, yung nakakahawa yan. So, number two, people themselves, siguro health literacy, they feel that if they don't have ubo and hindi na sila nilalagnat, ayaw nilang uminom ng gamot. And they don't know that TB is you have to treat it for months to make sure that the bacteria is eliminated from your body. Pag hindi mo kinomplete yung treatment, magre-recur siya. And then, so very important yun, na ma-protect natin yung, magkaroon tayo ng case finding. So the first step in TB is of course prevention. The second is active case finding. Yung active case finding, ito yung ginagawa namin ngayon. So we're trying to look at cases. So the ways to get active TB is, if they have symptoms, matest sila kaagad through a sputum test or through an x-ray or through the gene expert. Kasi sometimes they're already being treated, pero bakit pabalik-balik yung ubo? So yung gene expert, yun yung nagdi-detect ng multiple drug resistant. So mataas yung burden natin ng multiple drug resistant. Different class of medicines ang ibibigay para ma-treat natin yun. And treatable pa rin. Then there's the XDR, the extremely drug resistant. Yun din yung mahirap kaya naka-flag ang country natin pag may immigrant or OFW, kung minsan may dalang x-ray yan to prove na hindi sila nagka-TB. I had a nephew who's going to Georgetown. Yun yung questions. Have you ever had TB? Did you had your immunization? Nakatag tayo as a country na producer tayo ng TB. So, very important yan for our OFWs and everything. If we eliminate TB, then we'll have freer mobility to the rest of the global countries.
So screening is done through X-ray.
Yeah. So yan, the screening is X-ray. So doctors, X-ray, and then the gene expert, the sputum. Now, yun yung sinasabi kong AI. Kasi now the X-ray, kung minsan babasahin pa ng radiologist yan. So the important thing now is we're using AI, artificial intelligence, that can look at an X-ray and already tell you possibly TB. So then you can do na the next step, confirmatory yung gene expert. Then start na natin siya ng therapy. And then the after active case finding, making sure that you have TB control of the people that are positive. Pag nandun sila at nagpapagamot sila at matapos nila yung course, then that's actually a good thing for us. So that's -1 person with TB.
Okay. Nestor Corrales, Philippine Daily Inquirer.
Good morning, Secretary.
Good morning.
Secretary, have you discussed with the President your earlier proposal for him to lift the public health emergency due to COVID? And can you just clarify this one? Because there were previous pronouncement by the President saying na parang na-lift na rin naman niya ito.
Yeah, actually, during the time of they already recommended, the IATF already recommended the lifting. But I think the Office of the President had to study some other things that were the consequences of the lifting officially. One was the vaccine issue because mawawala yung EUA, Emergency Use Authorization, to get the bivalents. But recently, as you heard, Pfizer was given a CPR by our Philippine Food and Drug Administration. So the bivalent is now going to be commercially available. Ang delay lang is that Pfizer is looking for the retailers that have the -70 freezers. Kasi nga, it requires storage that has cold chain. I think what will happen is it will probably go to the hospital pharmacies. Kasi yun yung bumili ng mga -70 freezers. And some local chief executives also told me, bumili rin kami niyan during COVID. So we actually can store that. So I don't know how Pfizer will do this, but eventually it will require a physician's prescription, and then you can purchase it from retail, and you can also get access to bivalent vaccines. But for the poor, we're still negotiating with COVAX for 2 million doses so that we can still be able to give to those who cannot afford to buy the bivalent.
Okay.
So, sir, the President is okay for the lifting of the public health emergency?
Yeah, I think he's really instruction to me is really to recover from COVID and be able to get back the economy kasi we've lost a lot in the economy from the restrictions. So as you know, basically, nireiterate ko to kanina during our sectoral meeting that we now consider COVID among healthcare workers as similar to other illnesses like cough, colds, influenza.
Okay.
But you still have to protect yourself. I think the public health warning is you still have to protect yourself if you are vulnerable, and you still need to get the vaccine if you want to be specially protected.
Sir, if the public health emergency is lifted, ano na pong mangyayari sa monovalent vaccines natin previously given EUA? Madidistribute pa rin ba ito sa public for free o kailangan nilang makakuha ng CPR ng manufacturers para mabenta sa market?
Yeah, because we can still distribute them. I think they're still valid as booster doses, but most of the demand now is really the bivalent vaccine. Because that's the better version. It has all the Omicron variants also.
Okay. Alexis Romero, Philippine Star.
Secretary, you mentioned the Philippines being the fourth around the world in terms of TB cases. Ano na ba yung goals na naset ng DOH to address TB? Meron ba tayong timeline? Halimbawa, by this time, dapat ganito na lang yung cases. Meron ba tayong mga ganong targets?
Yes, the first thing I did was to appoint an action officer. Kasi madaming efforts yan. That's the effort of the local government. That's the effort of hospitals. That's the effort of national government to buy the machine. So, nire-review namin yung current program. Ako, ang personal target ko, if you ask me, is to get us out of the top 10 by the end of my term. If I'm able to go down to 11, I'll be happy. But usually, the idea is to find all TB cases. So, meron kaming rate, yung TB case finding rate, which we will see that hopefully it will decline, and what we call the cure rate of the TB you find, how many are you able to complete the 4 months course of TB drugs. So yun yung considered cured. No? So yun ang percentages na babantayan namin, the cure rate and the active case finding rate.
So by the end of the term, out of top 10, but yung immediate goal, Secretary, ano yung ating immediate target for this particular health issue?
Well, in terms of numbers, I cannot tell you, but I will tell you that I'd like to find all TB cases, so active case finding, and treatment to cure for all of this kasi it's curable. So, dapat walang mag-fall out. So, some TB programs, nakikita mo yung fall out, ilang percent. So, yun, maging zero yung fall out. Ma-complete nila yung whole TB drug program.
Okay. Heidi Sampang.
Hi.
Po, Secretary, may panukala po si Senator Jinggoy Estrada na imbestigahan po ng Senado yung mga fake advertisements na mga gamot at mga food supplements po na
Yes.
gumagamit po ng name or ng mukha po ng mga sikat na personalities. Sa part po ng DOH, ano po kaya yung mga action plans po na pwede ninyong gawin para mapigilan po yung paglipa na po nito sa social media na nakakabiktima po ng marami po nating kababayan?
Yeah, thank you very much. I've seen this in social media. Many of my friends, doctor friends, who are popular and specialists have been victimized for a drug that they did not endorse, using their photos taken out of social media. And these are really the scammers. So this is under the realm in DOH. This is under the realm of the FDA, Food and Drug Administration. They're a regulatory agency with police powers. So I think I will instruct the head of FDA, Sam Sakate, to actually coordinate with the NBI to really get to the bottom of this. Some of the personalities, Dr. Willie Ong, Dr. Liachon, have actually filed cases with the Cybercrime Division of the NBI. Pero nawawala and then bumabalik. Tapos ibang dignitar. So I think maybe you can help me inform the public that there are such scams wherein they use a popular doctor for a treatment of diabetes or treatment of hypertension that is not valid.
Pero siguro, paano po mai-inform or ma-educate yung mga kababayan po natin na huwag pong tangkilikin yung mga ganitong produkto available online na hindi po approved ng ating FDA? Ano po yung mga dangers po niya sa health?
So the first thing I will advise our citizens is to make sure that the drugs they will procure or buy ay may FDA approval. Meron yon sa lahat, sa bottle or sa ano, sa box, nakalagay FDA approved. And those are the ones that are legal. Many that come in are what we call illicit or the smuggled from abroad. They are not registered brands. They are contraband products, and the FDA can actually confiscate or close down stores or shops that sell this, even online. So I think I'll just instruct. I'm glad you mentioned that because I was reading that in the news na meron pa rin, and I thought it would already stop with registration of the phone, and di ba, meron na tayong phone registration. Should be easy to catch them with the SIM registration. But apparently, it still continues. They're still very bold in making all this Facebook and social media cards that seem to promote a certain drug using the image of a popular doctor.
Okay. Ivan Mayrina, GMA 7.
Sec, itong Clark Multi-Specialty Hospital, correct me if I'm wrong, but is this the first of its
Several
regional hospitals
Yes.
na gusto pong i-replicate ng Pangulo?
Yes.
Binanggit niya po ito sa kanyang sona nung nakaraan. How are we doing with this plan to replicate these specialty hospitals sa regions?
Well, let me correct this information. Although the president mentioned this, since we passed the sin taxes during my time when I was undersecretary, remember we were building heart, lung, kidney centers. So this effort to actually build specialty centers outside Metro Manila was an ongoing Department of Health project. And kanina during the meeting, I actually presented to the president those that were finished. For example, the heart lung center at Cagayan de Oro, which is doing heart operations now. Heart center used to go there. Now they already assigned a graduate cardiac surgeon that actually does practice there and continues na yung heart surgeon. So many of these other places that have been built through sin tax money have now eye centers, dermatology centers, cancer centers that have been built. Pero quiet, it's not getting the news, but the services are now available to people outside Metro Manila. So it's a work in progress, tuloy-tuloy yan. Maganda rin yung idea of putting them all in one place kasi nga, if it's regional, like the one in Quezon City, di ba? They're all together. They call that the ano. So the joke nga is that's Bituka Bituka 1 and the other one in Clark is Bituka 2. That's the joke among the doctors how they call it the lung, kidney, heart. Kasi that's the Bopis hospitals they call it. But that's us calling it fondly as a nickname. You combine all of these internal organs and then they have specialty centers for
So
all.
kung magbe-break ground na po yung sa Clark, do we expect the others to follow? For example, the one in UP Manila, may cancer
A cancer center. That's a PPP
Yes.
cancer
Oh,
center
and
in
also
UP Manila.
Naman, magkaka-PGH yata.
PGH,
dyan? Yes.
also as a public-private part. So we're doing all modes. This one in Clark has a combination of donations and government appropriations. So it's like a PPP as well. So we're harnessing the private sector that's been very, and I'd like to commend the private sector for helping me out in the goals for implementing the health outcomes. So they've been helping us a lot, reaching out that they're willing to help. So the government alone cannot do it. The private sector has a big role in improving our health services and the specialty services as well. So hopefully very soon those hospitals will rise. Ang maganda plan, it's phased. So it's not a very ambitious na it will rise agad. You know naman how it is, no? You build 1 to 2 years, and then you operationalize it. Then you wait another 2 years to get the program. So like the multi-specialty, the pathway is a general hospital, maybe 100-bed general hospital, and then it will become a children's specialty center, and then the heart will come in. So as it gets better, it will improve the services. And that has been the pathway in the other specialty centers in the different regions. So if you go to the different regions in the Philippines, they're now able to do, like for example, Southern Philippines Medical Center, may heart center na rin doon sa Davao, sa Southern Philippines. And most of the Davao people just go there to Southern Philippines for heart operation. Then we added the Cagayan de Oro. Then in Cebu, there's Vicente Soto doing heart operations. So ano yan, work in progress. You don't build a heart center in a day. Kasi matagal mag-train ng cardiac centers. Before I became undersecretary, I'm part of the trauma center technical working group kasi I'm a trauma surgeon. So trauma naman yung binibuild namin. We identified 22 trauma centers. But when we realized we had the money for the trauma centers, we realized we had very few trauma surgeons. So we're now pushing for training young people to go into my field of trauma surgery, so they will become the chief of those trauma centers when it's built. So we've established one in PJG, in Paulino J. Garcia, and one of the doctors there was sent to PGH to train under our team. So hopefully we'll return her again after 6 months, and then she'll continue running it, and she'll be the chief of that trauma center. So that's the one in Central Luzon. And then we have many more, Jose Reyes, East Avenue, and different parts of the Philippines. But the funding is like 4 or 5 per year, and then next year another 4 or 5. So I'm in that technical working group for trauma. There's a technical working group for cancer. There's a technical working group for burns. So there's a lot of money that's going to be put in nationwide development of different trauma centers.
Okay. So we have Kathy Valiente and Harley Valbuena.
Alvin, kabila.
Yes, sir. Good afternoon po. Sir,
Good
tanong lang
afternoon.
namin kung ano-ano po yung mga health-related bills na ipupush po natin ng DOH sa LEDA.
Okay.
Kasama po ba dito yung proposed bill po creating the Philippine Center for Disease Prevention and Control?
Yes, actually, those are several bills that I presented to the President as ways forward. The bill for Centers for Disease Control is now with the Senate. The House bill has passed. So the Senate is now redoing a version, and there are some questions to it which I was asked to answer as well. So they discussed din namin yan. There are certain provisions that they want to put in. The other one is the Virology Institute of the Philippines, but that's under the Department of Science and Technology. So may loop. Nasa Senate na rin yata yan for final details na lang. Hopefully mapasa na rin yan with the prioritization of the President. The third is dati it was called the Medical Reserve Corps, but this bill will now be called Health Emergency Assistance Auxiliary Response Teams. So this is like pulling all our doctors so that we can call them when we have a pandemic like COVID-19. So it's basically a pool, or they didn't want the name in the Senate, yung Medical Reserve Corps, because sounds so military. So they changed the name to HEART. So it's going to be the HEART Act. It's going to be a HEART Act. So it's basically asking private doctors to actually join the government when there is a crisis and doctors are needed. Ano pa ba yung bills na we want to also help the barangay health workers. So we're trying to look for find a bill to pass the Magna Carta for barangay health workers. So marami pa, virology, medical. I think those are the priority. Those are the bills, and they're very near completion because they're already in the Senate.
Okay, Harley Valbuena and then Alvin Baltasar.
Hello, good afternoon po, Ms. Daphne, Secretary. Sir, the DOSC Pagasa today just announced the start of El Nino phenomenon in the country. What are the health hazards of this, and what measures will the DOH do to keep the public safe from El Nino-related diseases?
Thank you. No, very important ang climate and diseases that go with it. When you have an El Nino year, that means that's more rain. When you have more rain, we start to have the vector-borne diseases. We start with dengue, because if you have more rain, drought. If there's less rain, then the problem is less production. It's food.
But we can also have longer rain, as the DOST said.
No, ang El Nino has both.
Yeah,
If they call it El Nino, it's both.
Yes,
There's
because
longer dry and there's heavy rains.
That's
diba?
right.
Yeah. So yung waterborne illnesses like dengue, you have mosquitoes that will thrive because if there's rain, there's pooling of water where the mosquitoes will thrive. Then you have leptospirosis also. And then basta all of them are mostly vector-borne diseases, gastrointestinal illness. When there is the longer dry season is really more for our food, in terms of shortage of food production, and that will, in some areas, may cause hunger and increase malnutrition. So we're monitoring this. Aside from that, heat-related illnesses will probably be a factor, because when it's El Nino, it's both very hot and very wet, diba? So very hot can actually affect a lot of people in terms of heat-related illnesses, from heat exhaustion to heat stroke. So we need to remind the public about all these diseases. That will be the role of the DOH to actually keep this information going out and telling the public what to do and what not to do.
Sir, mas mataas po ba yung risk ng pagkakaroon ng TB kapag po mainit nga dahil po sa El Nino? Or hindi naman?
That's a good question. but basically, what happens pag rainy season, when you have a respiratory illness, the chances of getting it is higher. So influenza season actually happens during our rainy season. Why? Because people stay in enclosed spaces, and if you just have one person coughing, that the rest of the people in the room get infected when they get out. So if you ask the TB, that's the correlate for TB. It's airborne. So if one person has TB and you're all inside a cramped space because it's raining outside and all the windows are closed, the chances to infect others is higher. So yun yung philosophy doon. Hindi yung dahil nabasa yung likod mo tapos tinangkaso ka. It's really a respiratory illness in enclosed spaces. Enclosed sa bus, enclosed sa taxi, and then you have other public people there. So yun yung main cause of that.
Okay. Now we have Alvin Baltasar, PBS.
Secretary, magandang hapon po.
Magandang hapon.
Ms. Daphne, magandang hapon po. Secretary, follow up ko lang yung question kanina ni Nestor. Tungkol doon sa public health emergency, doon sa lifting. For the record po, ano po ang pasa dito ni Pangulo Marcos? Inclined po ba siya na ma-lift?
Yes. Actually, this was one of his first instructions to me to really get out of the COVID pandemic. I think what happens now is that the risk is passed on to individuals. No, so there's still so for your information, the WHO already removed COVID-19 from the list of public health emergency of international concern. So it's considered by WHO as just one of the diseases. And even for us, doctors, we now also consider it as just one of the respiratory illnesses. There's still risk of death for vulnerable people, which is the elderly and those with the medical conditions or immunocompromised. But the number of deaths have really declined. So there are two things that cause that. Either everyone's already vaccinated, or number two, the Omicron subvariant is really milder compared to the original Delta or Alpha that killed so many Filipinos.
So, sec follow-up lang po. Do we expect the President na mag-issue ng EOR or memo regarding this in the next coming days?
Yeah, I'm just waiting for that IATF resolution. So the IATF resolution for this was issued by my predecessor, si OIC Barrera. So if that's not yet signed, I'll follow it up with the reiteration. Because I think at that time, they were still hesitant because there was still the problem of how do we get the bivalent, it will lift it. But now I think that obstacle is gone kasi may CPR na tayo and everything.
So we are headed there.
We are headed there. We are on the path. As I said, I told the President, thank you for bringing us out of the pandemic.
Right. Okay. I think that ends our press conference with Sec Herbosa. Thank you very much. Thank you, Malacañang Press Corps. Have a good afternoon.
Thank you very much. Magandang hapon po.
Sorry.
Actually, de facto, we're out of it.
Yeah.
The ambassador, and then